Have you ever been burnt or known anyone who seriously has been? If you have, then without a doubt you know just how much pain they have suffered. I would say that there can hardly be anything more terrifyingly painful or traumatic than being burnt. As though that wasn't enough, the daily reoccurrence of having to go through the long, excruciating process of having the dressings changed and the removal of dead or damaged tissue would be enough to make anyone run away. So it wouldn't surprise you at all to know that their levels of anxiety, pain and muscle tension go through the roof. Of course, they are given painkillers and relaxants to help them through this ordeal, but it is done in small doses, mainly for the fear of them becoming addicted to these strong medications. My attention was drawn to a study that has been based precisely on this difficulty. Here, 2 music therapies have significantly shown to decrease the pain patients suffer throughout the process of changing dressings. They were music alternative engagement, which works on the premise that if the patient's attention can be centered on a strong, positive and pleasant enough stimulus rather than on their own pain or anxiety, then the pain is reduced. And music-based imagery, which promotes relaxation in patients. Here it is important that the patient is able to hear and focus on the directions of the therapist. In this study, for just 2 days, 29 inpatients participated in an experimented trial. This is where the patients on the control day only received their normal standard of medication and care to help them through the process. And on the music day, the therapist helped them with music-based imagery. This is where the patients were asked to specifically express an idyllic imaginary scene where they felt perfectly safe and relaxed. This was practiced both before and after the dressings were changed. Now, in the meantime, while their wounds were having any damaged tissue removed, the patients engaged in the more active therapy of music alternative engagement. Different sets of data were collected from the patients before, during and after each time their dressings were changed. The researchers have said that the patients reported having significantly less pain and anxiety on the day that they had participated in music therapy compared to when they only had to make do with the medication supplied by the hospital staff. It was also noted by the nurses that once the patients under the music therapy conditions had finished their treatment, their muscle tension levels had significantly lowered too. As we can see, both of these therapies have made a huge impact on the lives of these burn patients and valuably serve as a relaxation and distraction technique to help them through this immensely painful procedure they have had to endure.